Just a few days after the doctors called off their strike and went back to offer health services to Kenyans, the EACC and the Ministry of Health are taking steps to ensure even the product delivery is above board by looking into the pricing of both pharmaceutical and non-pharmaceutical supplies in the health sector to ensure both the government and citizens get value for their money. A welcome move, especially after the health sector hit headlines late last year with allegations of a 5 billion shillings corruption scandal at the Ministry of Health. Part of the loot was said to have gone to some dubious companies as payment for medical supplies and equipment, which were never delivered. In some cases, the IFMIS platform was manipulated and double payment of goods made. In other cases, money was diverted from original vote without the right approvals. In this exercise, the Commission is looking for any loopholes, weaknesses, and opportunities for corruption and make recommendations on how to seal them. A team of 5 has been selected to conduct this exercise after reports by Society for International Development (SID) and Transparency International Kenya indicated that certain supplies are procured at a very high cost, which translates to a high cost to consumers.
The pricing of pharmaceuticals and non-pharmaceutical supplies in the health sector is critical in determining the overall success of the health sector. It is also crucial in ensuring that the government gets value for money and thus safeguarding the public resources. In essence, it impacts on the affordability of medical supplies.
The EACC will look into all agencies and institutions that deal with procurement of drugs and other medical supplies, which include Kenya Medical Supplies Authority, the National Treasury, Public Procurement Regulatory Authority, and private suppliers.
I ask each and every one of us to participate effectively with an open mind to make sure we provide information to the review team which will allow them to come up with the recommendations which are implementable and which are best suited to our people.
The EACC lists health among services most prone to corruption in the counties, and it says this exercise falls under its mandate to prevent corruption and identify realistic, fair, competitive, transparent and cost-effective ways for pricing supplies. Mercy Okande, NTV.